Okay. I think this is everyone that was hanging out in the waiting room, and since it's already a little bit past 11, we can probably just go ahead and jump right in. Good morning, everyone. Thanks for joining. Some of you, I believe I've met. Jana Darlington here with Provider Relations. We also have Elizabeth Sharp, Director of Optimization, and something else that I am going to get your title for because it is very long. Kevin Kelly, Project Manager, and then Christy Howe, Director of Information Management, who will be taking us through the demo. To start today, I just wanted to share my screen. We're just going to do a quick overview of the PCP reward plan because that's kind of the basis of, what started the PER, why we're talking about it, and why it was created. So, can everyone see that? Looks good. Okay. So the new PCP reward plan is effective for this year. Before anyone gets, nervous about that, because we're in October, almost November, I just want to make sure that we're going to, let you know we're going to address that shortly. But the new PCP reward plan was really created to better align with how the network earns gain sharing. Previous reward plans really focused on quality, but our network also has a budget component. They want us to come in at high quality, but also beating the budget. So the new reward plan is really designed to incentivize both of those behaviors. It also has a component about citizenship, which we'll talk about as well. As I was mentioning, we are in almost November. And there is, you should have seen a communication that came out late last week that leadership at HB has decided to hold our providers harmless this year, just because of the delays that we've experienced with data quality and also rolling out the PER. Providers really haven't had the opportunity to have insight or time to work on these elements of the plan. So providers are going to be rewarded on an equitable basis for 2022 performance. So there's going to be no difference for the basis of quality, cost, and or citizenship across providers. The only thing that will change a bit is based on patient paneling. So those providers who have patient panels that are larger than 500 patients will receive the same base component for quality. And then providers with less than 500 will receive the same across that level. It'll just be a smaller amount proportional to the other folks who have larger panels. This does not change any calculations for the base component, which changes each year as we earn gain sharing, and then also attribution. So that's just going to be a little bit different for those components, but the quality is going to be the same across the board based on those two tiers. Something that's also changing with the new PCP reward plan is the time that it's paid out for. We used to do quality incentives paid out in the first quarter, early second quarter of the new year following the performance year. With this new PCP reward plan, the quality incentive and also gain sharing are going to be paid out in August or September of the following year. So for 2022, we are expecting, gain sharing quality incentive payments to be paid out August, September 2023. We're still talking about this PCP reward plan, also the PER, because it's still going to be relevant for 2023. We did not, make this new change for it to be relevant for only 2022. And because of some of the issues that we've encountered this year, our plan is to try and keep those components as close to what they are going into 2023 as possible. So you can work on the things that you wanted, we wanted you to work on in 2022 going into 2023. It would be not great if we decided, excuse me, that we're going to have you guys working on these items for the next 2 months or, however long 2022 you get to work on it. And then January rolls around and we're like, well, we're going to change that up. So we're going to try and keep things as close to possible as we possibly can. So what this kind of looks like, I'm just going to go through each of the types of providers who are going to be impacted by this change. First, we have family medicine. So you're going to see we still are heavily incentivizing quality programming. So your quality measures are going to be 50% of your reward plan, depression screening and follow-up are going to be 10%. So that's going to make up 60% of your quality, your gain sharing components for the reward plan. We also have cost saving initiatives. So in family medicine, we've got two. We've got LARC training, long-acting reversible contraception. That's going to be 15% of your cost-saving initiatives. And then we also have pharmacy. So I'll talk about pharmacy briefly on the next page. But in regards to LARC, we do have two trainings for the education component, so not the placing component of LARC, which is one part of what it's going to be like in 2023. On November 17th and December 7th. Those are both 5:30 to 6:45 p.m. trainings. You only need to attend one. Kevin is here and you can reach out to him in the chat if you have any questions about that, because he's really facilitating that. Then we have citizenship, which is 10% of your reward plan. So citizenship, Christy's going to go deeper into this, and I also have a slide later, but citizenship is really going to be those behaviors that are, show you're working with AHP to get to those goals. Are you coming to adult PCP or pediatric PCP meetings? Do you have someone who's in place as a practice champion? Those types of behaviors. As I mentioned, we've got criteria for the pharmacy reward. So there's 4 medication initiatives for 2022, and hopefully these will be the same for 2023. Insulin Lispro, long-acting insulin, metformin, NSAIDs. Those are the 4 medication switches. So if you switch people for, the lower cost alternative, that helps you meet this component. One thing that, Christy's also going to talk about is people who, aren't eligible for switches for whatever reason. So we'll get more into detail about that. Satisfying the citizen component. So if you meet 2 or more at the practice level, you earn that for all the providers in the practice, or if you meet that for, at the provider level. So let's say you only meet 1 component at the practice level, but you can pick up the other component at the provider level. So you'll get that 10% for citizenship. Internal medicine, you're probably wondering, well, what happens if we can't do, if we don't have the population for LARC or we don't have the population for pharmacy? Internal medicine, and I'll talk about pediatrics also, is kind of what this looks like. So in internal medicine, that LARC component is absent. So what we've done is redistributed the 15% to quality programming. So quality measures is now worth 65% instead of 50%. And you have the 15% for the cost component, but everything else remains the same. And in pediatrics, the opposite is true. So there's no pharmacy component, although our new director of pharmacy, Bob Adams, is also doing his world tour right now to kind of get feedback from some of our providers in the adult space, but he's also really putting some effort and thought into what pharmacy initiatives might look like in the pediatric space. But for now, LARC is the main cost-saving component in the pediatric space. So that 15% that would have gone to pharmacy has been allocated to quality measures, and now you've just got the 15% for LARC and the cost-saving initiatives. So this is kind of what, the PCP reward plan is going to look like for AHP in the future. Wanted to make sure we gave you a nice overview of that before Christy dove into the PER demo, because really we want these things to work together. So in order to do that, we wanted to give you guys more insight into how you're doing across the board for your AHP participation, not just quality measures, which you can get in Arcadia, but also some of those cost-saving behaviors, citizenship, and things of that nature. So I just want to take a brief pause to see if anyone's got any questions before I let Christy dive in. AHP team, I know I'm not doing this any near justice as Renee does, but is there anything you think I've forgotten to mention? No? Okay.
No, did a good job.
All right.
All right.
So I'll let Christy take over now.
All right, so I will be taking you through a demo, which is a PowerPoint. today. Reason I'm not showing you a live system is that we've got a variety of people here from different practices and different roles, and I don't want to show PHI and practice data specifically for somebody, so I can always blind that in a PowerPoint. I also want to show you the version 1.8, which we are in final testing around right now. And it will be posted in the next couple of weeks into production. So I want you to see the new features and functionality that you'll be seeing. So this today will look a little bit different than it will look if you log in immediately following the training. There's a few things that are just not available on the current version that's in production that's coming very soon. So where I'm starting is at the AHP homepage. So the purpose of this provider engagement report is to give you a dashboard that you can log into, not every single day, but to be able to see how you're performing and earning your maximum potential reward. Also to be able to pull patient lists and actionable data, figure out where you're going to focus. So we want this to be another tool that's really easy for you to use. We need it to be intuitive, easy to find, and be able to go back to it when it's convenient to you. So first and foremost, we needed to make it easy to find and easy to log into. So in the AHP homepage, we put this green call to action button in the upper right-hand corner called Provider Engagement Report Login. So all you have to remember is go to the AHP homepage, click on this button, and it takes you to a detail page all about the Provider Engagement Report. So everything you need to get started is here. If the system is down for any kind of quarterly maintenance, you will see an alert on this page and telling you when it will be going down and when it is going to be up. We're not going to send you out emails telling you when there's maintenance, telling you when there's issues. You're not going to be logging in every single day, but if it is something that you're trying to do that particular day, you have a problem, go to this page and see what it says. We also have contact information for the URMC help desk to either call them or email them for support if you're having trouble logging in. If your username, you have problems with your password or the duo in the setup there, they're the ones who will support you on that. For the provider engagement report itself and what you see in the provider engagement report, the HP team is supporting that. And so there is an email address that you can reach out to with suggestions or questions or feedback. And the team here and an extended team will be monitoring that and supporting you and any issues you might have. Also, a couple of call outs is there's a quick reference guide, which I'll show you shortly. If later on you need to add new accounts for your practice, there's a guest account FAQ to remind you what's involved in that. We're kind of shepherding everybody through that right now, but it would be the same process with a future user. And then on the very bottom, we have release notes. And so as there's changes to the version that's in production, we're going to create a list of what are the changes that have been posted and when. Some of the big ones will also include in network news and other things, but a lot of times it's just little glitchy things that we might be fixing or improving that we'll list there. So a quick tour of some of these links. The FAQ or the quick reference guide, it's only a 2-page document, and it's just calling out what some of the little symbols are as I'm going to be going through these and pointing them out throughout the demo. You don't have to take notes. You can go to the website, you can download this, print this off. It's just the things that may not be intuitive if you're first stepping into the dashboard. The second page of this is the functionality that's a little less intuitive, and that's how you download a patient list. It's really not complicated. It's just that they call it a cross-tab download instead of a data download. And so we wanted to give you the steps, and I'll be showing you what this looks like as we go throughout the demo as well. So that's as much as we think you need to know it, in a quick reference guide. So we hope that that's encouraging to you, that this is really very simple to use. The guest account FAQ. So these are all the things that you need to know when you're requesting a new account. And just a couple of words around why do you need a guest account for the URMC network? We have a relationship with the medical center, and we are hosting this data in this dashboard on a server, an AHP server on the URMC network. It is protecting the PHI in it, and your user account or those of your staff, part of the guest account creation is for you to designate who has what level of access. So only you are seeing your practice's data or your own data, unless you give somebody else permission to see that. So we are very, very careful with who has access to the information and at what level they're given authority. So that's why it's a guest account in the medical center network, is because it's hosted on that network for you in order to provide maximum protection. This page here is a release notes, just a quick example. It's an old example because we're up to version 1.8. And as soon as that pushes to production, well, this document would be changed. It would have the version number and the date and I'll show you as we get into the demo where you can see what version we're on in the dashboard. It also breaks down by component, as you'll learn more about, and just the types of changes at a really easy to understand level of what changes were included. So to go to logging in, let's get into the meat of this now. So here's the login page, but to get to this, you need to click on this golden colored View Provider Engagement Report button. You can always bookmark this URL and go back to it directly to log in directly. However, we encourage you, if you have problems getting logged in, that you come back to AHP's Provider Engagement Report page on the website, because it'll provide you additional information and then who to contact for help if you're having problems. But I'm going to click the button, and it takes me to this login. So once, if you have an eRecord account that you're used to logging in with, it's the same exact account. We're adding Provider Engagement Report to that same account. So same username, same password. If you don't use eRecord, we're setting you up with a new user account. The domain would be blank the very first time you log in. And there's two choices in this list. One is UR, Active Directory, and that's the university. URMC is the University Medical Center's Active Directory, and that is the one you would be logging into. If you tried the other one, that's the non-PHI protected network. So think about it being medical center, it's PHI, and that's the login directory you want to go to. Username, password, click sign in, and you are going to be presented with the Duo authentication. So part of the setup of your account includes creating instructions for this Duo. It's set two-level authentication. So the username and password you enter is level 1. The Duo authentication is the final step in confirming you are who you say you are. You have there's an app you can put on your iPads or phones or devices that you could put a push to send you it's accept or approve, and you click the button, or it can call you and you would answer one or no, yes or no through the push buttons. Or you can also use the app to look up a passcode and then type in that passcode from that app. I love the push. I click push and then authenticate on my phone. And as soon as you pass, you're logged directly into the homepage of the provider engagement report. So this has been designed to give you a holistic look at your performance, so that you can then see where you want to focus and dive deeper if you need to. I'm logging in as myself. If you were a provider or a practice manager, it'd have your name and your practice name here. Upper left-hand corner is the version. This is version 1.8, which is coming out soon. If you are a provider logging in, you have the ability to look at some of the information at the practice level. So you could see how the whole practice is performing, say, on depression screening. But then you toggle to an individual level, and that's where you can drill into your specific details. If you are a practice manager or a system administrator, these toggles really don't derive much benefit for you, because you can drill in and filter down to a variety of levels. These little three bar icon in the upper left-hand corner is the feature to open up the filtering. We have it closed to start with because many people don't need to do anything at all to change their view. If you are somebody who has multiple practice, multiple provider level views, then you would want to click on this and it expands it. I will show what this looks like in the next couple of slides. But I'm going in here as a super user and just wanted to show you what it looks like. So provider rewards, this is the component that's going to tell you as a provider how you are performing on your total maximum potential. But because I'm not a provider, it's telling me rewards are earned on a provider level. So I have to filter down, and I will show you that shortly. Same thing with cost versus quality. The PMPM and the percent of points earned, that's calculated at practice level. So I'm not at the right level to see this. Quality measures is coming soon, and we're going to drill into each of these components. But you can see there's a space for the things that are important in part of your reward plan. We have a blank space over here for a future initiative. So let's see what a provider sees. So I've drilled in here on a particular practice and provider. I've blinded the data so you don't really know who it is. But this is now showing us that we're at 44% of the potential 100% reward earned. And as you can see, there's some different colors that we're starting to pop up. Some of the components only show when you are drilled into a practice or provider level. Green is good, meaning you've hit targets, you're earning the maximum potential for that component. Blue is an area that you have room for improvement. And you have some potential earnings that you could achieve if you focus in this area. So we're going to first drill into provider rewards, and then we'll talk about each component as we go along. So I want to see what makes up this 44% of my reward and where I can also work more. So this page is a little bit busier than what it would look like if I was just a provider logging in to see myself. If I was only looking at me, I'd only see one section at this top line. What I'm showing is what it would look like if you were a practice manager and able to see more than one provider at your practice. So you could see how everybody is performing. I've blinded who the provider names are, what's the practice location, and if you are also at a system group that would have multiple practices, you could see the breakdown here too. You can filter down to look at specifically one level of information, including what components. So components are the metrics and the targets of the reward plan. And so this is an early example of just some sample data that we were putting together to test the functionality out. So we're only seeing 3 of the components right now. Jana shared that quality has a percentage of the reward. LARC for some providers will also be on here. So what's important is to know that whatever the reward plan is for the provider is what's going to be displayed here. And there are a few areas that are variable, as Jana covered. Pediatrics and family medicine would have LARC, whereas that might not be on the reward plan for the adult practices. Pharmacy cost is also variable because not everybody is prescribing in the 4 drug classes that are available for our pharmacy initiative. So in the example where also pediatrics don't have pharmacy cost initiatives, so pharmacy cost is removed. And so the reward plan column will show specifically what your potential earnings are and what makes up those percentages. And then the reward earned is what you've achieved to date. And I will go through as we start looking at the various components. We try to refresh the data in a meaningful time frame. So depending on the data set and the component, we are at a different refresh rate. But as of the last refresh, where are you at in your reward earnings? And then what is the potential still left on the table? Where might we want to focus? So this top example here is, let's take a look at depression screening. There's 45% to my reward that's tied in there. You know, how am I missing? And then we would go back to that component and look more into there. The other thing to note here is that this is downloadable. So if there is a practice manager or a system quality person that wants to export this out to Excel and then filter and work with this data in Excel, this is a downloadable component as well. So we're going to go back to the homepage. So I covered, unfortunately, there's a double menu caret over here underneath my drop down, but that's the way every component navigates back and forth, in and out. So I'm going to come back here and we're going to take a look at cost versus quality. So this is at a practice level because this is data that we get from Excelis on the PM basis for the Excelis contracts. That's what we're demonstrating here. This is not a reward component, but it's an important part of the reward plan in the provider engagement report because the whole purpose here is to reduce costs and improve quality so we can maximize the money that we have to distribute for gain sharing. And so as I drill into here, I'll show you, this is really a place for you to see how you're doing and to have a conversation with us about areas that we could work on together to continue to drive down costs and improve quality. So I'm going to click on the double caret here and drill into cost versus quality. And so first thing to note is the bottom left-hand corner. This is an old screenshot. So, but the sources of this data are really important. We still don't have the 2022 data from Excelis on the cost of care. We're waiting for that to come out. As soon as it does, we'll load it up and we'll present it. We should be receiving it on a quarterly basis, and we should have gotten Q1 in May. But they've been having some challenges this year, so we're quite a bit delayed. So this example is using 2021's data. Quality snapshots are taken on a monthly basis. This data comes out of Arcadia. We take it the first of the month. And so this source is an example of June 2022. And what we're trying to do is show you how you compare to your peers. So since this is a practice level view of information, your peers are like practices. So pediatric practices are compared to pediatrics. family medicine to family medicine, and internal medicine to internal medicine. So when you look at the next version of this dashboard, we'll probably have the keys a little bit better, because you can see the lines are starting to get really close to each other. So your practice is green. The other practices is black. And so what we want is your practice to be doing as well, if not better, from a per member per month cost basis. So we'd love to see you at or below the black line. And this is for pharmacy. Same thing for medical expenses. And then as we get the 2022 data, we'll start to see less of the 2019 and just have this rolling window. The other interesting part here is now putting it together and looking at where you compare in quality and cost to your peers. And so your practice is the dark black diamond, and other practices are the gray circles. So if we hover over yours, there will be a pop-up that tell you overall PMPM and quality for your practice. If you hover over any of the other dots, you can see where they're at, their actual numbers, but you won't be able to tell which practice is whom. That's blinded. And our goal here is to move you and improve quality while reducing costs. So we really are shooting to drive you into the lower right area of this graph where possible. So this the quality is on the bottom. These are showing the quality targets for our bronze, silver, and gold, and the cost PMPM is on the vertical. And so the line along the middle is the average PMPM. And this is an example of this practice is doing quite well. They're at average PMPM, actually just slightly below it. And we want to continue to work on cost improvement initiatives, but we definitely have some opportunities to improve quality. So we would take a look at where we might want to focus some effort. So this, like I said, is not a specific piece of the reward plan, but it drives the conversations and informs some of the work we do together to maximize the money that we have to pay out in that reward plan. So we wanted to make sure that we were making this visible and accessible to you. So I'm also going to click to go back to the home page, and we'll talk just a moment about quality measures. So this is going to remain coming soon in the version 1.8. As you know, we've just had an upgrade in Arcadia, and we're seeing some not completely accurate quality performance right now. Hence, we've made a decision to hold practices harmless for this year. What this component will show once we have confidence in the data is just your percent of points earned. So instead of having to log into Arcadia to see how you're doing on that quality percentage, you'll see it here in the context of the reward plan. We're getting awfully late in the year to do too much more development beyond that. When you do drill down to it in next year, we're going to show more detail around each measure, where you're performing, and possibly some trending if we can get the trending data back. Our goal is not to replace Arcadia. This is only refreshed once a month at the beginning of every month. It's the first Monday of the month. So it can become outdated, and for any exact pre-visit planning, any exact performance, most up to date, your EMR data feeds are coming in on a regular basis, and we want to make sure that you know that the most accurate data is in Arcadia itself, and we don't want to reproduce all of that. So we are going to take a look now at citizenship. So citizenship, as Jana had mentioned, is earned at a practice level or a provider level. So we're showing you both. At the practice level, if there were 2 or more out of the 5 criteria, this circle would have been green, which meant they earned this reward, this 10%, for all the providers of the practice. But because this practice is only done 1 out of 5, they have not earned it for all the providers. Therefore, how the provider is doing out of the 5 criteria is very important. This is a provider that's earned 3 out of the 5. So they've earned that 10% on their own. I'm going to drill in here and see what that 10% is and what the criteria was. So in this example, this practice, the practice manager attended 2 meetings during the year, but some of these other criteria weren't complete. The provider requirements, we got 3, which was they attended clinical grand rounds, or they're on a committee board, practice champion. And these lists could change or expand each year. They're not going to change in the middle of the year. Like right now, I've got to add Vatica in here, and we're starting to talk maybe about collaborative care, maybe adding in as a criteria for a provider level. But you know, we're trying to be reasonable with many opportunities to be engaged with AHP, things that we think are really important and attainable without a lot of effort. As you can see, opt in for the emails is one quick and easy checkbox for a provider level engagement. I'm going to click back, and I'm going to go back to the main home page. In depression screening. So this is showing at a practice level how this practice is doing on their depression screening as a whole. If I was the provider and I toggled over into individual, then this is one of those components that changes to just my patient panel here. So I'm going to drill in. This is telling us first how large is the patient panel of people who are 12 and above, and how many have been screened, and then what's the target for 2022. And then this shows we have some room for improvement. So I'm going to drill in, and these are different screenshots. So that first page, yes, it says 894 patient levels, but I wanted to give you a good example with a lot more numbers to show. So this is a depression screening page for a broader network. This was pulled on September 12th. The upper right-hand corner will always show you when the last refresh date was. And this is data coming from Arcadia. And I believe depression screening is every Monday. We refresh it every week. So top down shows you more and more information. So the top bar is the total patient panel. And out of it is how many patients have been screened according to the keys below. The blue in the middle here is no screening. They haven't been in for their annual checkup, and they have not had the screening. And then the teal color is that they've been in for their annual checkup, but they have not had their screening. So the 2 lines here are important. The lighter dotted line, and if you hover, it has a call out, which tells you what this exactly is. But the lighter dotted line is last year's screenings. And our goal for the initiative is to improve every year, year-over-year improvement. And so the darker line is for the improvement target. So what I like about this example is that we have an opportunity to hit it here, because of the patients that haven't been in yet for their checkups, as long as we make sure that we do the screenings while they're there, we can hit this year's target. If this upper section where you've had your annual checkup, but there's no screenings, seems correct to you, then, you know, maybe we need to look at workflow for next year. If this doesn't resonate, and it seems like that's a little high, that you are doing more screenings than we're showing. And we need to take a look at the data between the EMR, where it's being captured and how it's flowing into Arcadia, because that's the data we are using. So this is just, we're going to be looking for everybody to provide us some feedback and to figure out if we need to dive in a little bit more, making sure that we're accurately capturing and categorizing the visits. Second bar is the screened patients. So this 9,374 is this smaller bar at the top, same color schema. But it's showing us of those screened, how many have the at-risk scores 5 to 9 versus how many are positively screened. And because there's only one that's positive, you can't even see that color here, but you can drill down to the third bar and see those that have had positive screens, how many have we documented follow-up and captured that in the EMR. So the other thing I love about this is that you can click on any of the bars and you can get a patient list, because what we're really trying to do is give you some actionable information, things that you can do to help improve your performance and care of patients. So the patient panel is hidden just for performance reasons. So if it's going to load up with 40,000 patients, it slows this page way down. So if you click on this, any one of these colored sections, you're going to get that patient list for patients in that bar itself. So I did an example of those that have no screenings but have not been in yet for their annual checkups. And the reason I like this one is that you can see in the patient list, it's the name, who's the provider, which will be important if it's the practice manager. When was their last screening done? And when is their next visit scheduled? And so you may want to export this patient list out and see about going and getting these patients in to schedule their annual checkups. The other one I think is really good to do is to click on the at-risk patients and maybe look at those and see when their last screening was, and if there's a follow-up you want to do just to check in and see how they're doing. The other thing to call out on this page is this underneath the updated date, there's another link to drill down even a little bit further and review the depression screen follow-up initiative. So some of these components are quite complex, and depression screening and follow-up has a big initiative behind it, and there's a lot of materials. And the other thing we want is to make sure that we are making it easy for you to find what you need to know while you're in the provider engagement report. So this drill down, and each component is going to have some level of help, will take you into an information page. So it reminds you what this it is all about. So a high-level explanation, program descriptions, really important, who are the key people to talk to at AHP about it, and links to our website or other important resources for it. If I go back, we're going to go back to this page and a couple things to call out. There's some hover help and some eye information icons. And so if you hover over anything in this top panel, it tells you the actual numbers behind those lines. The baseline last year was 938. The target this year is 1,057. So you can get to the numbers without cluttering up some of these graphs. The other thing, the eye help, you see it scattered throughout the dashboards. If you hover over that, it pops up definitions or things that we think are important, that once you know it, you may not need it, and we don't want to busy up the screen. So we put it on a hover section. So as you could see in depression screening, there's hover help on each one of these panels, which defines and articulates a lot of the things that I've just described for you. Going back now to pharmacy costs in the lower left-hand corner. So version 1.8, when this publishes, this component's actually going to look a little bit different. Right now, what we're showing you is your comparison to the network as a whole. And the reward, as Jana shared with you, needs to be a little bit more granular than that. Just not how are you doing compared to others in the network, but more how are you doing in each of the drug classes that you are prescribing in. And so as a provider, if we have 4 drug class initiatives, you might not only be prescribing in 2 or 3 out of those 4. And so we've drilled down into the details around each of the drug class and made the reward reflect what you have the ability to impact. And the other thing to note is also it's prescribing for your own prescribing, not specialist prescribing. And so when we drill into this next page, this graph at the top is each of the 4 drug classes. And the patient list below are those patients that you have the opportunity to move them from more costly medications to less costly medications. And what we are looking at is only the most recent 4 months, because you may have already switched somebody, and we understand it takes time, for them to get their next fill to fall off the more costly medication list and onto the less costly list. And so we're always looking at the sliding window of 4 months. This is also only prescribing on MVP and Excelis claims only. We don't get fill information on your entire patient panel. So these are the ones, though, that are really driving that RX, PMPM that we just showed on the cost versus quality dashboard. So this can directly impact how you're performing on that portion of that graph. The other ad that you'll see in version 1.8 is just like we saw in the depression screening. There's going to be a couple target lines here. How's the network at a whole doing on average? How did you do last year, and what's your target for this year? And so you'll have some target lines in each of these drug classes. If you're only prescribing in 3 out of the 4, the third one's going to be blank. Blue is opportunity to improve. Green means you hit the maximum for that. So in this particular provider example, they've earned 50% of their pharmacy reward because they've performed in 2 of the drug classes. There's 2 that we can still work on. So if I click on one of these graphs, it filters my patient list below to just those patients in that drug class. And then I can export that out to an Excel spreadsheet, and I can evaluate whether or not we can switch that patient. Now, pharmacy recognizes that not everybody can tolerate or should be switched to the less costly medication alternative. So we don't want to be constantly nagging you for the same patients over and over and holding you accountable to a target you can't achieve. So if you have a patient that you cannot switch, you can reach out to the pharmacy team and request a clinical review, a chart review of that or medication review of that patient. Once the pharmacy reviews it and agrees with you that they're not a good candidate for this switch, we would be marking that patient in the back end of the dashboard as reviewed and excluded. And when we do that, they fall off the denominator. They might still be shown here with an exclusion there just to show that they're still on the more costly, but they're not going to be negatively impacting your performance. And so you'll be able to hit your targets. So this is a good one where I wanted to show the download capabilities, because I think this patient list is one of those actionable lists you may want to take out to Excel and have somebody in your practice working on. So in the upper right-hand corner, and again, remember, this is page 2 on the quick reference guide. So you can go to our AHP website, click on provider engagement report, get to the FAQ, which shows you the exact steps to doing this. The upper right-hand corner of each of the dashboard pages, there's a little download icon. When you click on that, a menu pops up, and there is a PDF and a PowerPoint or an image options. Those are definitely what they say. You can take the page as you see it and export it out either to a picture, a PDF document, or a PowerPoint slide. But what we see on this pharmacy savings is that there's a scroll bar here on this patient list. So there's more patients than you can see. And so just downloading it as a PDF or PowerPoint, you're not going to get the entire patient list. So that's why we want to download a crosstab, and we want to get it into a usable format, say Excel. So crosstab, unfortunately, data will be grayed out for you. You can't get to data. Data really means it's all the data behind every single component on this dashboard, and most of it is going to be meaningless to you. We want to go to a crosstab, which actually looks like an Excel spreadsheet. So hopefully that becomes a little more intuitive after you've done it a couple of times. So you go to download crosstab, and it pops up a menu or a list of things you can download. And unfortunately, it's the data behind every single component. And as I said, most of it is not useful. The patient list is what we want. And so we were trying to get the patient list to come to the beginning of the list. So when this popped up, it was right there. You just pick the first one and you download it. And of course, we couldn't get it to sort right. So we named it consistently on every page where there's a patient list. It's called _ patient list. It will always be the very last component on this download crosstab feature. So you just have to scroll all the way to the right, click that, and then you can export it down to Excel or CSV. So it's unfortunately a little bit of a scrolling, and you have to make a choice, but it's as quick as we could make it. When you do download, it goes through the download, and then it creates the spreadsheet or the file in your downloads folder on your computer. And it's also in Windows, it's in the bottom of our browser that we can open up. And it's going to be showing you exactly what you see in that patient list. So you would be seeing the patient names, date of birth, things that I've masked here for PHI purposes. And then last but not least, we're going to go back here. And then the last component we're showing is LARC. And this might look a little bit prettier in version 1.8. Right now, it's a very simple initiative. The target to gaining this percentage of the reward is to complete training. The 2 training dates have been scheduled, or 3 for this 4th quarter. And right now it's just showing a blue check, kind of tiny. It'll be a little bit bigger, which means that the training hasn't occurred yet. As soon as you've attended, you get a big green X, and you've earned that piece of the LARC. The drill down will likely be the training dates and just some helpful information. And then as the initiative evolves and grows in future years, there'll be maybe more details and more data that we show you there. So that is the provider engagement report in a nutshell. So any questions? I see nothing in the chat. Everyone, I get a couple questions that I kind of weave into the next presentation. So hopefully I've managed to answer most people's prior questions throughout.
Yeah. So I guess then we will do it this way. If you have any questions that come up later, feel free to reach out to myself, Renee, or Christy. And then there's also the AHP per at something on the guest on the per page. on our website. So if you have any questions, you can also feel free to reach out that way. And we will love to hear from you. Anything else we need to chat on? I think we're good. Elizabeth? Kevin?
Yeah, I think the only thing I would add is that I don't recall if everybody's completely set up with their guest accounts. This is a multi-step complex process. Cherie Turpin has been sending emails and working with folks to making sure that we're kind of navigating through the process. Once you do your URMC account setup, there is one last step that I need to take to actually turn it on for you. And so we'll be sending a final email once that step is done to say, oh, by the way, now you can really log in. Go to the website, click in and take a look at the site. So.
If there's no questions, then folks are free to jump off as they will. I'm waiting on a response from someone, so I'll be hanging on here. Thanks for joining, you guys. Have a good day.